Okay, we are resuming the physical assessment. This is part 2, so my videos aren't too long. After we've gone through and did all the lymph nodes and the sinuses, we're going to check the cranial nerves. First we're going to start with the trigeminal nerves. I'm going to use a Q-tip here instead of a cotton swab, and I'm going to feel on your face and you tell me what it feels like, okay? And tell me where am I touching. Okay, and right about now?
Forehead soft. Cheek soft. Chin soft.
Okay, very good. So his trigeminal nerves are intact. There are three branches of the trigeminal nerve, and we just went through all of those. Okay, next we're going to test the cranial nerve number 7, which is your facial nerve. So I'm going to have you close your eyes really tight, close them really tight, and then don't let me open them. Very good. Open them. Okay, I'm going to have you smile really big and show your teeth. Good. And puff out your cheeks. And don't let me push in. Okay, very, very good. Okay, his cranial 7 nerve is intact. Next is the cranial nerves 3, 4, and 6. And this is checking for nystagmus. So I'm going to have you follow my finger. Okay, so we'll start here. Okay, and you want to do this really slow to check for nystagmus, which is any abnormal like shakiness in the eye, or the right to left of the eye, and his eye is very midline the whole time. Okay, and as for the corneal reflex, you'd want to use a cotton swab, but I'm going to use a Q-tip, and you're going to put it right to the side of the eye, and he should blink, which he is. It kind of hurts a little bit. Okay, so the corneal reflex is intact. Okay, now we're going to check his pupils. Make sure they're reactive and equal to light. Okay, so I'm going to do this again. Check your eyes. Very good. Just look straight ahead. Okay, they are equal and they are reactive to the light when I'm flashing in his eyes, and they are about a size 2, and they're growing to a size 3 as we speak. Okay, very good. And I'm going to have you look at the stocking on the wall over there. You need your glasses, okay? And keep looking at it, and then I'll look at my finger. Very good. His pupils constricted appropriately as they should from going from distance to up close, and that tests his accommodation. Okay, very good. And now we're going to check all of his eye fields. I'm going to cover one eye, and tell me when you see my fingers.
See them.
Okay.
I see them. I see them.
And over here.
Oh, I see them.
Okay, very good. All the areas are very good. Over here is a little bit closer, but I have the right eye closed. And again, you would want to do that on both sides to make sure you're testing both sides accurately. Okay, now we're going to test the acoustic nerve, which you would test with, it's a gross motor hearing test. And with that, you would use the whisper test. So I'm going to have you cover your left ear. Okay, and I'm going to whisper something in his right ear and see if he hears it.
Mm-hmm.
Okay, and he hears that just fine. Okay, so his hearing is intact. Next is the cranial nerves 9 and 10, the hypoglossal and vagus nerve. I'm going to look into his mouth to test this. Okay, try to put your tongue down and swallow. Okay, and here, here I'm checking the uvula, and it is symmetrical, and the rise and fall is appropriate as he is swallowing. Okay, in cranial nerve number 12, it's going to test his tongue reflex. So I'm going to stick out your tongue, go side to side. Okay, very good. Okay, so we just went through all the cranial nerves, and all the nerves seem to be very intact. Okay, so we've done the head, the ears, the eyes, the nose, the throat, gone through the nodes, the sinuses, and the nerves. So next we're going to go down to the thorax area. I'm going to have you scoot to the edge of the chair, and here I'm going to start with touching his back. I'm going to go down his back here, all the way down his back, just feeling for any lumps or anything that feels abnormal, and everything feels fine. You always want to start up at the scapula when you're doing this. Okay, and I'm going to palpate all the way down, and you want to go from side to side don't want to do straight down one side, straight down the other. You just want to keep going from side to side. And make sure that you get into the mid-axillary area. Okay, we'll do that on both sides. Okay, very good. Okay, and in the front, I'm going to go ahead and take a listen. I'm going to start with listening with the diaphragm, and you want to start up at the clavicle on both sides. And take a breath. Take a big breath, and out. At the same time, I'm testing his ease of breathing. He has no difficulty breathing. He's able to take nice big deep breaths for me. Okay, and up here are the bronchiovesicular sounds, and when you get to the main stem of the bronchus, these are the bronchus sounds, and down below are the vesicular sounds. And you also want to listen on the back as well, and you want to go from side to side and not straight down. I'm going to listen to the apex here of his heart, and I can hear the lub-dub, the S1, S2, very well. And I'm going to go through and go to the bell, and I'm going to listen for the aortic, the pulmonic, the the tricuspid, and the mitral. Okay, and that is the 8-to-man mnemonic. Okay, and I'm going to just palpate over the apex of the heart. And I'm going to put my palm at the apex of the heart and just palpate the heart. And put my palm again down at the bottom of the heart. Okay, very good. When you're listening to lung sounds, you want to have your patient leaning forward a little bit. And when they're lying down, have them in the left lateral Sims position. And then if your patient has a heart murmur, you would want to listen with the diaphragm of your stethoscope. It'd just be a little bit easier to hear. So we've gone through, I've palpated the back, and we've listened to lung sounds, we listened to the heart. He's taking nice deep breaths for me with no problems. Just looking at him, he looks like his respiratories are about 20, which are normal. And his lung sounds do sound very clear, no problems there. Okay. Okay, so we're going to go ahead and go into the musculoskeletal area and go from there. So I'm going to start up here, and we're going to palpate all the way down to the elbows and the arms and to your wrist and to your hands here. And you would want to go through each digit, feeling both hands. Okay, very good. And while I'm here, I'm going to listen, I'm going to feel for the radial pulse. Okay, it's a good bounding pulse, and also for the brachial pulse up here. Okay, and you want to listen to both sides. Okay, very good. Okay, and I'm going to go down here to his legs, and I'm going to feel for the pulses in his legs. You put your leg out here for the dorsalis pedis pulse, and the popliteal pulse right here behind his knee, and the popliteal pulse in the inside of his ankle here. Very good. And you want to test for, or look at color, feel the warmth. See that leg? Both sides feel they're warm to touch. Good color distribution. There's no swelling in his ankles. And I'm feeling for any pitting edema. You would hold that for 10 seconds to check, and I don't feel any edema in his feet. I'm going to extend your leg out. And this is passive range of motion, which is very good. Okay, and I'm going to have you do it on your own. And this is active range of motion. Okay, very good. And now I'm going to have you put your elbows up. And as I'm pushing in, I want you to push out. And just the same, do the same thing. Okay, and with your hands, put your hands down, same thing, push in, and out. Now hold your hands out. And yep, keep them webbed like that, and don't let me push them in. Okay, and close them, and don't let me pull them out. Okay, very good. And I'll do the same thing with your legs. I'm going to push in, and you try to push out. Okay, and same thing. Okay, very good. All of his muscles seem to be intact. He has no edema. His skin is very good. I don't observe any lesions or any bruises. He obviously takes very good care of himself. Any questions up to now?
Nope.
Okay. All right.